Welcome back to another episode of the 1% Podcast. Today we are excited to have Dr. Daniel Gibson joining us on the podcast. Dr. Gibson is a clinical psychologist who's very well respected in the industry. He's written extensively and has worked in a clinical setting most of his career. He's worked for the Department of Defense, including doing interviewing and mental health providing at the Pentagon. His research and background is extensive, and so we're excited to have him here on the podcast. He currently owns and operates GPS Anxiety Clinic here in Meridian, Idaho, as well as another branch in Caldwell, another one soon opening in Emmett. So as being a business owner, he brings a unique perspective of philosophy, science, and life experience to his practice and what he brings to his patients. So we are very excited to have Dr. Gibson join us on the podcast.
Overgeneralizing has that dangerous consequence because whenever we don't like something, whenever something's getting in the way of our values, it's designed to, another part of the brain will send memory of all the other times we face that thing, and it'll send another hormone to make you want to hate and eliminate the problem. Is it me? Is it that environment? And so then that's going to send that anxiety response to stay away from it or hate, eliminate, suicidal thoughts. Now, here's where the issue is in the mental health arena, is that you've got some providers who are only approaching it from the biology standpoint to treat the emotion and the symptoms. But remember, the brain has laws for efficiency's sake. You have to find and model and seek and be humble enough to realize that if you practice, you put energy in any area of life that you want to thrive in, but the brain needs a coordinates, the how-to.
Today's guest on our podcast is Dr. Daniel Gibson. Dr. Gibson, we're glad to have you here with us. Thank you for taking your time.
Glad to be here.
As we kind of talked off camera a little bit, I like to start by introducing you and or allowing you to introduce yourself, just asking questions about your background and life growing up and your family and those sorts of things. So tell us about where you're from, where did you grow up at? What was your family like growing up?
Absolutely. So I grew up in Fruitland, Idaho. I was in the middle of five, have a younger brother, two older sisters, younger sister. Pretty basic root, sort of small town feel. My grandfather was an immigrant from Sicily. That had an impact on my life. I was always over there with him. He was sort of a migrant individual most of my mom's life, moving all the time. So spending a lot of time and the interest and the background, the experience, family, meant a lot. So that was a really good kind of upbringing, small town.
What did your dad do for work? What did your parents do? Did they both work? Was your mom in the home?
Yeah, my mom was in the home. My dad, he hoped to continue dairy farming that his dad did in Nessa. He started that when they were first married, doing sugar beet and dairy. But then his dad and mom moved back over to Utah. And so he was left without being able to buy that. So then he was running around trying to find work. He was climbing poles for Idaho Power and broke his back, and then sold for dairy gold delivering. And then there was a layoff and kind of hit a fork in the road, and that stress. I remember being a little boy, seeing him crying on the bed, fearful of what he was going to do. And mom and him both prayed, and it felt like insurance didn't make sense to them. And then an opportunity came up. And so he sold insurance, as far as I can remember, back from when I was like 3 or 4 years old.
Oh, yeah.
Life and health. And it was a good experience watching him. I got to go with him all the time to work. I was always interested in going in the car with him in the summer and wanted to just follow along and watch and observe.
Yeah.
It was good.
Yeah. So what ultimately drew you to psychology? Was that something that you kind of knew from a young age, or that just later on in life you were kind of ended up being drawn to that?
Yeah, I'd say I always liked kind of getting in the mind of everybody when I was a kid, and like could empathize with a range of people. With the, typically hung out most with like the big athletic group, but was always watching other people and kind of thinking about what, if they were left out, what are they thinking? I was always fascinated with the mind, so to speak. I was always even in my own mind all the time. But you don't talk about that much growing up.
Yeah.
It's not that cool. So, but I was always in that, had that interest. School was not something, both my parents didn't really do much of college. My dad did a little bit, but didn't stick with it. So it wasn't, you knew you were going to do it. You knew, it was emphasized, go do something that makes a difference, helps people. So that was always talked about. And so that just constantly wanting to kind of get into the understanding of the mind and helping people out when they're having a hard time, adapting to different situations. So when you're thinking about careers, I remember as a teenager thinking it'd be cool, but I did not like school.
Yeah.
And so I was thinking I'd say that to teachers when they'd say what you're going into school for, what you want to be. Yeah, I probably want to go into psychology or something. But in the back of my head, I'm like, too much school.
Yeah.
So it was it was kind of a shock because school wasn't a huge focus in my family. So it wasn't a thing that you really, really prepped for in that way. I'd say my own issue, like in elementary, first grade teacher kind of, I think, made a big impact on that. Like I had a really hard time, new teacher, pushed out in the hall a lot. Felt like I was not good at it, felt pretty dumb. And so then it led to just more of that. I kept to myself a lot. I didn't complain about anything. So, so that led to more things where it got so bad that I guess mom found me changing myself in my room. And it's like, what's going on? And embarrassedly told her that I messed my pants at school. And she's like, well, why didn't you tell the teacher? I was like, oh, I did. And then she found out that there was all these little things. And then it led to another teacher said, I'll take them in the middle of the year. So that was embarrassing, dropping out, like going into another classes. So then, third grade teacher told parents in a teacher's conference he'll likely never graduate high school. So that really pushed the buttons. So I always, as a little boy, wanted to do big things. So then as a result, school was one thing that I thought I was just not cut out for. So I put it in focus in other areas, trying to be popular, trying to be an athlete. And so all the energy went into that.
Yeah.
But there was always this fire and desire I knew I wanted to do something that could provide well for my family, do something that could take care of things. So I remember always like even praying, like somehow when I knew I wanted to go on a mission, like, God, if you can make me better, please somehow do it because I'm not liking where I'm going. And so when I hit Sydney, Australia, first day, pain shot throughout my whole body. I felt a lump on my neck and caused pain through my eyes. Anytime I read, anytime I lifted something, kept it a secret, didn't want to go home. More stuff started happening. Trainer, every time I opened my mouth, was kind of rebuking, that could have been better, that could have been better. It was basically the worst case scenario in my mind that would make me feel defective. And I'm thinking like, why? Like, why? I'm feeling sorry for myself. But 2 weeks into it, just impressions came that this was the perfect environment to accelerate the opportunity to prove that, no, this is the environment of helping you become what you hope to become someday. And so the more I faced difficulty after difficulty and rose above it, started to realize, hold on here. It's it was at this fork in the road of over identifying as a kid, like good at this or not good at this. So stay away from things you aren't good at. This is maybe just who you are. And then all of a sudden that didn't sit well when you're trying to pursue a career after my mission, starting college and all that. So I had to go through disability services to have everything read to me and extra time on tests. And so that journey took a long time, and I started with something I thought was easy, going in something that I knew. I was wanting to teach like martial arts, do art, and do maybe some teaching. But then just this desire, got a job working with kids and individuals with major behavior problems, going out amongst them. And I learned about social work, and I was like, oh, I didn't know you could be a therapist if you get a master's in social work. Not as long as psychology.
Yeah.
So I started that route. Then I went into social work, BSU social work, the bachelor's and the master's in that. But then this itching started to occur continually. What once was hard is no longer hard, and kept putting myself in new environments, but always wanting to do better than what was happening. I worked in child protection for a few years and was not happy with seeing this limited mental health care or the lack of quality of it.
Yeah.
That was the biggest frustration. So I remember meeting a psychologist who did an evaluation on one of the moms I was working with, and he's like, do you mind if I take you out for lunch? And he said, absolutely. And so I asked him what he did and what he studied in school, and it's everything from organizational business consulting to clinical psychology to assessment testing. You can do whatever you want. And that all of a sudden, in addition to at the same time I was learning about the military and the opportunity of going in as an officer in the health professions realm. And I still had that health problem that limited my wife was my eyes. When I eventually got married, I thought, like, who would want to marry this defective person who can't even lift a jug of milk, can't read? So it made me have a perspective of what kind of person, that sort of character of who would invest in somebody.
If you don't mind me asking, so how did you meet your wife, and
Yeah.
what did that look like? Like, how did that process take place?
So she was actually going to, I think, BYU, Idaho. I was going to TVCC at the time.
Okay.
And she showed up at a dance, and, in a small area, so you knew all the girls, and I was, dating different individuals, and it just was scared to invest in them. And I think it was one of how, marriage and family and providing and all those things were always emphasized in my family.
Yeah.
I was always nervous about, making that choice and being very aware of that choice. And then my health problem added a whole new level of fear. Like, what kind of person would actually have that stick to it factor, who wouldn't quit if things get hard, who would believe in somebody who doesn't have a lot of evidence on the outside, that
almost like seeing yourself as like a new car or something that someone's, looking at prospectively buying.
Yeah.
Okay, well, this one's defective or has some
Yeah.
things broken on it. So
Yeah.
why am I going to buy a broken new car?
Absolutely. So then and I met her, and just, there was just that natural kind of connection and similar interests. She seemed to, it just all fit very well. And I was nervous still, and broke up with her and was dating other girls, but just couldn't get that comfortable, wonderful feeling out of my mind for her. So then I kind of pleaded back, like, I'm sorry for how I treated you, was out of fear. And she took me back, and then
History from there.
But yeah, literally, she was my eyes, like everything, like literally everything she'd read for me. If I was having to write a paper, I'd speak and she'd type it and read it back. And so we did everything together all the way to my master's in social work. And I knew that I was going into psychology. I didn't know at that time.
Yeah.
In the military, but I was like, that's impossible with this health problem. Doctors said, if back in when I first found it, that they said there was some abnormal bone growth in a spot in my spine right beneath my skull that all the nerves were entangled in it, and that if they went in there, it could paralyze me or kill me. Unless it was malignant, they aren't going in. So I had to learn physical therapy and pressure point and just adapt with the pain. So, but I knew there's no way I could do psychology with it. There's no way I could go in the military with it. So I went back to the same neurosurgeon 10 years later. Advanced imaging, he saw it and more clearly, and it was abnormal bone growth, but it had a joint hooked to the skull, and all the arteries were in the middle of it. And he's like, "You were born with this," but never had any issues until the first day mission. And he's like, "We need to remove it because now that we see what it is, if there's one hit, one thing, it will kill you or paralyze you. All the nerves will get cut." So went into the surgery and had a miraculous experience in that way. And then
How old were you approximately at this time?
29.
Okay.
29.
So you're married, you already have kids.
We didn't have kids.
Okay.
My wife, we didn't know why we weren't at that right before that. We found out she had like polycystic ovarian syndrome and infertility issues. We were going through in vitro around that time.
Okay.
We lost 3, and then she got the in vitro doctor felt bad and did the next one, no cost, already had the extra fertilized eggs. And then that's where our twins. So she was pregnant with them right at the time that he was doing the surgery, right at the time that I was applying for doctoral school, not knowing whether or not I could actually do it.
Yeah.
So yeah, and then they were 3 months early. So they're 1 pound babies. And so we were in the NICU at the Ronald McDonald House for 3 months of my last semester of my master's in social work.
Wow.
I was doing work from there, going back and forth. And then we were supposed to go to Pacific University in Oregon, Portland area, right that fall. So they were out 2 weeks, still even had you had to stimulate their feet to keep their heart going. They had heart monitors on them. We're like, what are we doing? But family tried to convince us to stay 1 more year, but we just felt like it needed to go at that time. It all makes sense now, because if we wouldn't have gone when we did, I wouldn't have been trained by this world-renowned psychologist who changed the trajectory of my specialty, one of my specialties. And so
tell us about him and tell us about that experience, if you would.
Absolutely. So we went into a Doctor of Clinical Psychology program. It's a 5-year program, so that after the first year, you compete to get on different teams. And those teams are different specialists who will train you for that year of 25 hours a week in the clinics. Johann Rosfuss was the individual. He was known, they were joking, he's like the Hollywood, 1 foot in Hollywood and 1 foot in the university in his clinics. So he trained all over the world, providers, psychologists, the military, wrote books for providers on understanding how to do exposure-based therapies, was world-renowned all over the shows, movies, scanned brains pre and post treatment, could see the brain change. So got the opportunity to be on his 2 teams of his. And so he was the one who trained me in the clinical realm. And so with that, I've always found that I would draw to people who are successful in whatever they did and go to them and want to learn from them and understand what got you to where you are. And that's always been the case. So whatever I was interested in, if it wasn't school and if it was wanting to do this or that, be popular, this or that, I was always trying to find this modeling.
Recognizing patterns in people and trying to follow them.
Mm-hmm.
I'm not all that dissimilar. I'm doing the same thing. I'm just hosting a podcast doing it. So
there we go.
Yeah.
And so that was always the case. So whatever the focus was, I was always looking for modeling. The issue though was at the time, until he trained me, there was this growing discrepancy of how to even look at your overall self. In psychology and the mind, there's so many different theories out there. And there's no other field in healthcare that is so as confusing as the mind.
Yeah.
You go and see a cardiologist, you expect they're all trained to have the similar foundation. They're going to approach problems the same. The mind is not that way.
Yeah.
You could see 100 different and they'll have 100 different perspectives.
Yeah.
So that idea of up to that point, there was this battle between kind of an over-identifying. I want to become like somebody. I want to become like somebody. And so then it always felt like a little bit of a chameleon. Like, am I faking? Am I modeling? Am I just pretending? Who am I really?
Yeah.
All those little natural battles that we all go through were always happening, but I was always in conflict with that in my mind. And so when I was on his team, the things we were doing was mind-blowing. It was seen somewhat skeptically from other providers and psychologists, the exposure-based therapies, the cognitive behavioral models. However, where it comes from, it's the one that has been the most proven through science. It's the one that says we'll prove ourselves. Study us. We'll do neuroimaging. We'll prove that the mind has laws. And it was always in labs. It started with Ivan Pavlov and the classical conditioning.
Yeah.
And it's not been broken from that. It follows that exact same principle. Sports psychology follows the exact same model. Training animals, same exact model. It crosses all learning. And so it has a foundation of making absolute sense. But when you're going and seeing somebody, and I remember sitting with him in one of the supervision, and I said, what in the world makes you so different? I said, there's thousands and thousands who say they do CBT and exposure therapy, but how are you so different? You get results that nobody else gets. You're understanding something that's far beyond anybody else. And he said, you got to remember that CBT and exposure therapy are just terms that were made up to explain how an organized way of how to do an intervention. But it all came from laws of learning theory. And learning theory is what Pavlov discovered. He didn't create it. He found that you don't have to teach a dog to salivate, right? But can you condition a dog to salivate with a bell? And that changed the trajectory of what those branches of psychology were studying. Is, can we condition? Can we decondition? Can we counter-condition? Can we modify these things? Can we create? And they're starting to see that this crosses all learning. Doesn't matter what we're talking about. Crosses species, crosses everything that is involved in learning. And so then when they got out of the labs more in the 50s and 60s and started to see a big need in the mental health arena, because the Freudian line was always doing the therapy. They jumped into the treatment center and they created a theory out of it. Like behavioral therapy, cognitive behavioral therapy, and then exposure came later. So when somebody's learning and they're only learning the surface, you're just kind of doing something at the surface. He said, you must understand the laws of the mind, and it has laws. You have to understand learning theory so that you can completely adapt to the individual's circumstances and situations. He says, don't ever dare say this to anybody else. I'll deny it. It could get me in trouble. But he's like, anybody gives me their will and they want to completely change anything about them can absolutely do it as long as their will's in it. The brain is plastic. It's malleable. It's changeable. And that whatever you learn, whatever your thoughts are, whatever your values are, whatever you act upon, your brain will literally change the very structure. We would do scans pre and post treatment. We started to see that. Studies replicated that again and again and again. And so that understanding that then put a lot of my energy on learning those laws. And learning those laws made so much sense to what my past experience was like.
Mm-hmm.
Is that, when you over-identify with something like, oh, I'm not good at this, and it creates that sort of response of avoidance, starts to then send that message like, this is a threat. Threat to what? Feels like me, my worth. You start to go towards different things. But then all of a sudden, if somebody wants something and they put themselves in that environment repeatedly and they're looking at what is it that goes into that when somebody's doing well, let me model that. The part of the brain that controls those areas, like whether it's a certain way of judging, certain skill set, whether it's an athlete, and they're modeling, the brain is starting to create pathways that will mirror and mimic.
People might almost call it like a self-fulfilling prophecy.
Exactly. Right? They might say that, right? But there are absolute laws. And when you do that repeatedly, the brain's all about saving energy. So when there's a combination of biology, the psychology is the way we think, behave, that creates an emotional cycle, and then our social world. That's one of the reasons I studied all three. So I also got a postdoc, Master of Science in Clinical Psychopharmacology, to be able to do what psychiatry does with labs, examining the body, prescribing when needed to make things a fair fight. So when you combine all three, you see that when somebody's born, maybe craving or believing a certain way or being more prone to enjoy a certain thing in life, that you see those areas of the brain that are in charge of that have already pathways that are kind of got a head start. Now, anytime you're trying to change, the brain or the body needs to borrow energy.
Yeah.
And so then that fight or flight kicks on. When that's on, the body can't rest and digest and take care of itself. So it's all about preserving. So like if I'm right-handed and I'm, or you're right-handed and I'm asking you to write something down, you just need to think about what you want to write.
Yeah.
You don't have to think about how you're holding your pen or pencil. But if I say, wait, I want you to use your left hand, frustration will go in because you don't have the muscle memory and the pathways that are as similar as your right hand's capacity. Same exact areas of the brain, just in a different area to control that. So that repetition, that practice, will have to borrow energy from the body, from the rest and digest system. If you repeatedly model it, exactly what your right hand's doing over repetitive time, pretty soon you won't have to worry about it anymore. You'll be able to write just as well, if not better, depending on how much time and energy you spend. So then it doesn't need to worry about focusing anymore. It doesn't borrow any stress hormone. It becomes a new autopilot. That is the law of all areas of the brain. When we think and when we behave, instead of a movement that's the muscle memory, like that reflex, it's an emotion. And that emotion's meant to make it so that we're efficient, so that when we're facing a new situation, we don't have to judge it like we've never seen it before. Yeah. So as a result, in learning these principles and what he said, the accumulation of everything I've went through, my experiences, my knowledge, my passions, pushed me and propelled me into the excitement of wanting to go even further into this. And so, now this is a key factor. It was his world. Like, he gave all of his time and energy into becoming like in his field. He had a day where he would only dedicate to writing and furthering himself. He had days where he saw so many patients. He oversaw anxiety teams throughout Portland, was all over the news on the outcomes and things. He was on the media. He was traveling all over the world. And he ended up getting a brain tumor. He had a do not resuscitate bracelet on. And he was quiet about his own personal life. He was from Sweden and he didn't talk about that kind of stuff. So there was a lot of other stressors he was facing outside of this passion that we would see all the time. And you could see that those other areas weren't doing as well as this psychology field was doing. Family, his marriage, had divorces, he had a relationship with a past student, and then she was wondering whether he was cheating on her. There was all these added stressors. He was having seizures. We were going to present in DC at an international conference. He was supposed to show up. We were going to tour the Pentagon with him. He didn't show up. Everybody's coming all over the world to go hear him and not just his students. So these kind of things would happen a lot. And I was also doing organizational business psychology at the same time as clinical psychology. And one of the things I was supposed to do was help him start an OCD center. And so I was doing organizational work with him, supposed to meet with him, and he reached out and he's like, "I'm sorry, but I'm going to have to cancel today." And he took his life. And those elements, those help further solidify the importance of, it doesn't matter if you understand these laws, they're laws, but they follow principles that they demand a coordinates in every area of life. They demand to have a value of what is it that I'm after, whether it be your career, so that every emotion will keep you accountable to that. If you feel anxiety, if it's healthy anxiety, it's going to push you and motivate you to get acting upon the things that could get in the way of what you value. If it feels guilt, you did something that would completely take you off the course that you're shooting for, that would allow you to get back onto it. Feel happiness, you've worked and hard and you saw a result. If it's all working for you in those realms, that muscle memory, that autopilot, that emotional autopilot, so to speak, will refine you and keep making you better and better in that environment. But when you walk out of that environment, you're walking into another. And I like to compare it to, you're a farmer in an orchard in your own life. One tree is your career. One tree might be your health, and one tree might be your hobbies. One tree might be you're a father. One tree, your marriage, and so on. That a farmer is moving about. You can never tend to all of them at the exact same time. When you're in one, you're dedicating to that one. And each type of tree requires a different principle of how you tend to it. Each tree also has roots, a core belief value set that guides you into different assumptions of how to get the kind of fruit you're after. So we think and often over-identify with these things in our lives. And so therefore, when we struggle or we're comparing ourselves with somebody, if we're doing it from the other types of psychology, unhealthy comparisons, for example, as they say, comparing that person to me, and as a result, I feel maybe defective. I feel less than if I see a difference. That's overgeneralization is one of the most dangerous things we could ever do with the human mind. Brain doesn't do well with that.
What would be some specifics of that? Like how someone might overgeneralize or over-identify or something?
And it can be anything from, starts from a young age. A child gets a good grade. I'm smart. As a result, what happens is the brain wants to get effective and efficient.
Yeah.
So then it's going to start to find trends, principles, so you can be efficient. So as a result, anytime you care about something, it's going to put it into a larger category. That when I do well, I am whatever that bigger term is. So I'm smart.
Yeah.
So then in school, I'm smart. I get a bad grade then, though. It will use the same pattern of thinking to hate and eliminate that problem.
Yeah. Which I literally remember feeling this exact same thing. You're right. Like this is, you're describing how I have largely felt a large majority of my life. Like growing up, I remember, my mom saying that to me. I remember a teacher saying that to me, and then wanting to be that, right? Like,
exactly.
Okay. Oh, the teacher thinks I'm smart and asks about these other kids. And so then, okay, I want to do that. But then it's almost like you self-identify with that. And in a way, it becomes a self-fulfilling prophecy where it's like, okay,
Yeah.
I'm going to work harder now. I'm going to make sure that I pay really close attention because the teacher thinks I'm smart and therefore I need to help all these other kids.
But the danger underneath it is the brain's getting repetitive rewarding of these pathways get stronger. No different than a muscle memory. If you're learning, like as a basketball player, to shoot a certain way, the more you do it, the more those areas of the brain are going to be firing. And the brain loves to save energy, so it will want to generalize that.
Mm-hmm.
So as a result, that's why a lot of people with these confusing messages that come from the other branch of psychology, the hundreds broke off of Freud, because Freud approached things from the outside in, whereas the Pavlovian branch was from the inside out, first starting with animals, that there isn't a thinking pattern. It's like looking at these laws of conditioning. So as a result, though, is we get these messages of, embrace yourself, love yourself, good messages, but the way that it's described can reinforce this pattern of overgeneralizing. Because the brain is designed that from a young age, it demands values. That's why a child, once language begins, they'll ask a ton of questions. Mommy, Daddy, what's this? What's that? It demands to have order. Like, is this good? Is this bad? Why is this? Why is this? Why is that? They also have a lot of mirror neurons to make up for all the things that they can't ask, to mimic and model it so that they would be able to have that resource in the future, so they would have an autopilot. Same in the animal kingdom. So what I mirror and what I model, the more I do it, the brain will expound and continue to behave that way.
So I wanted to ask you, because this is a question that I think about a lot, and I think that is widely debated, about the idea of nature versus nurture, right? If a little baby lion is born and it never sees another lion kill something and eat something, you can go feed it, right? It can never be exposed to hunting, but to some degree, it has that wired into it, right? Like that instinct is there. I was thinking about this yesterday. Actually, I was picking my daughter from school, and I see this kid come walking out of the school with what appeared to be his dad. He looked very much like him, walked just like him, was dressed very similarly to how he was. And so, like, that's something that I've often thought about is, do people simply reflect the circumstances of their environment? Do they learn these behaviors? How much is like maybe pre-wired into them, so to speak? But also with this idea that the brain can change, right? Like the way that you think can completely change. And so you're not predestined to something, but certainly the environment that you're in, the things, behaviors that you're mirroring, and what you see as normal in your view of the world is obviously going to have an impact on the way that you think and the way that you act.
Absolutely. And it's definitely, and this is often the unsatisfactory. That's why I've always wanted to be unsatisfied with surface level responses, but the surface level response often is it's both. Okay, but well, why? And I want to understand it from a deeper realm. Biology, yeah. So like the genetics we gather from our parents, depending on what DNA strands and what level of patterns we get, those areas of the body and brain and eyes and everything.
Why siblings are going to be so different.
It'll look a little different because of the way that those strands exist. Now, as a result, though, you're going to see similar temperaments too, because every region of the brain, think of the brain like a universe, and every little area has a very, very specific job. And it's a complex network that is having all these connections and pathways. So as a result, all of the things that are gained, you're going to start to see a sort of natural approach or temperament with different children. But you're going to see that, like, oh, I can see a little of me in that. I can see a little of the mom, or I can see a little of their grandma or dad, because those areas have taken more of what they accumulated. And I emphasize accumulated because there is some research called generational trauma that has an impact on the actual offspring. What we now know is that when you face things because of neuroplasticity, your brain and body change.
Yeah.
So if I'm facing a lot of chaotic, traumatic experiences, those are going to shape and change the very structures and fibers of my brain, the way I think, the way I behave, the way I feel, my instincts, all of it. And we could see it in SPECT scans. We could see it in functional MRI imaging, EEG patterns, recognition, all of it. And anybody who's having similar symptoms, you would see similar, almost identical areas of the brain looking similar. That's how we look at diagnoses. We'll see, in SPECT scans, severe depression. These are the patterns, the inflammation, the blood flow you'll see, and you'll look like all those with it. OCD, similar. So similarly, that's what happens. And then you have, that changes your DNA as well.
Yeah.
Okay, so your DNA starts to be impacted and imprinted upon what you're experiencing. So as a result, you have children more likely to pass on some of those traits. Same thing for struggles of overcoming, rising, things gained. It changes the very fibers of your body and your brain.
Well, in almost a more simplified way, I remember working on a project like 12 or 13 years ago, and it was a state-of-the-art dairy facility where they were putting in air-conditioned areas, heated areas. They had this massive facility where different types of feed would be put in, and differing amounts of the different types of food, whether it's corn or soy or grain or whatever, would be mixed up at different rates based on what the cows were needing and based on like this test that they were having.
Awesome.
But the entire theory was all based on the easier that you can make the cow's life, the less stress, the less impact that the cow actually feels, the higher quality milk it will produce, the better quality beef it will produce, all those kind of things, right? Like in Japan, they call it Kobe beef. Here we call it Wagyu, but basically that idea that you are physically changing the animal based on the circumstances and the stress and things that are happening in its life. And so that's maybe a far cry of an example.
No, and that's the goal, is to find the patterns. Meaning if something makes sense, especially I encourage that, like across the board for everybody. If somebody's claiming something about the mind, you should be able to see those laws, those principles across
playing out,
all learning, all areas of life.
Cross-culturally,
also you see each other. Yeah, like you should be able to see it. But if you're like, well, that's not the case, then it starts to mess with like how grounded is that?
Selective science. Yeah.
And so that's the thing, is that should be encouraged. It's like, look for the patterns, because the patterns will be there and you can't dispute them because you can see them everywhere.
Yeah.
And that's that principle, is anything that you're putting in changes the very structure of what's going on. And the laws of the brain are, it's something we're experiencing. One area is in charge of moving a part of our finger. Another area near that, a different area of the body and brain. One area for thoughts, one area for different emotions, and they serve and do different things. And they change constantly with what our environment does. And so what we do with our environment is having an impact on that. And so that's that next part. So this is where it starts to get a bit of a difficulty, is because, let's say, the temperament of the child. If the temperament of the child and the environment has a hard time being able to adapt to that temperament, and to then, let's say you see them and you know what would be a meaningful that you wish for them to be able to accomplish, there's going to be a certain degree of how far away they are from that with their susceptibility of what they cling to.
Yeah.
And how much of a fight that might be, how fast you try to propel them to it. Because that's why, if it's not this balance, this meeting where they are, and a gradual process, it will be combative.
Yeah.
It'll turn into not ready. Then because the brain of all children, to save energy up to the age of 10 on average, to save energy, they do what's called splitting, all good or all bad. Mom gives me what I want, dad gives me what I want. He's or she's all good, not all bad. Smart, stupid. It's to save energy. Problem is most of our conditioning occurs by the age of 8 to 9. So now we're always trying to unlearn and rewire some of this thinking. Now, why is this important? Is because you'll hear a lot nowadays on the focus of the emotion. When you're going and seeking a prescription, it's like, I've been feeling anxious. I've been feeling depressed. I want this to go away. So we start to create this negative relationship with what emotion is. I want to mirror the idea of an emotion to a muscle memory. That would be no different than if an athlete's saying, I tend to do this. Can you make this completely change for me? Without understanding what led to that muscle memory, that condition response.
Well, and I wanted to ask a question with that. Your view on medication versus, changes through therapy and through steps that people are making. It, my belief that I say to people all the time is that if you have a doctor, someone that you're seeing that's not asking you about how you're eating, how you're sleeping, your exercise, your environment, the things that are going on in your life, and they're just prescribing you a drug, you don't have a doctor, you have a drug dealer. And so I think that that's a very prevalent situation in our society today where people, I heard something the other day, like over 30% of adults in America are on either an antidepressant or an anti-anxiety medication, which absolutely blew my mind. I'm not sure whether that's correct or not, but the statistic of that is like staggering. What is your view on when medication, and I'm not anti-medication.
Sure.
I think there's places for it, but what is your view on when people need medication? You mentioned like giving people a fair fight in some instances where maybe their body's deficient in some areas versus being able to make small gradual steps to be able to get there. Because I also believe that if you expect someone to make a massive change in a short amount of time, it's highly unlikely that they're going to succeed, right? Like people generally succeed best by, if you're struggling with depression, like don't try and change your life 180 degrees. Like just get out of bed today.
Absolutely.
Like just go for a walk to the kitchen.
Absolutely.
Tomorrow, take a couple steps outside. The day after that, maybe do a push-up, do a jumping jack, like small little steps. So what's your view?
Absolutely.
Trying that.
Yeah. And that's where, again, that balance of the biology, because there are very specific pathways, certain areas that allow us to do a certain something. Challenge a negative thought. Hold on to a positive perspective. Open up an area of the brain that would allow for calming of a stress response. And you can see dysfunction in what's going on in the individual. And no matter how much they try, or no matter how much something makes sense, you can't stop that from occurring. So when you start to look at the brain, no different than any other organ in the body, in that they're supposed to have a homeostasis. And that homeostasis is the ideal of full functioning, whether it's the heart, a certain valve, a certain digestive enzyme. There's a homeostasis, but it's never always there.
Yeah.
The further it's away from that, pathology. Now, that's why these different diagnoses for different specialists. Your liver and your pancreas are struggling in processing sugars and insulin, type 1 or type 2 diabetes. If you didn't have that name, you wouldn't have the knowledge of the exact targeting to help those specific symptoms. Think of the mind, though, like I said, like a universe, and every region has a role. So each diagnosis has a very, very specific pathway and set of pathways in mind that are going to cause predictable struggles for the individual and every human being. You will see that, a lot of times, if they don't, sometimes there isn't that fair fight. that are so severe that even with the most evidence-based interventions, that it's not that fair fight. And so then all of a sudden you add that medicine or that holistic or whatever that would target those specific parts of the biology. And then you put them in the environment and you teach them the new way of thinking and behavior. And they change the response again and again. The brain then changes. Here's the issue when treatment is broken up. Let's say I am struggling with symptoms of severe OCD, which is somebody who, when they have whatever they value, their brain is firing intrusive, unwanted thoughts. Now, we all have thoughts that were like, oh, that was messed up, or, oh, I would never do that, or thoughts that would like make you like, whoa, that was weird. And we can dismiss them. We're like, oh, that was just a thought. Or, oh, I wouldn't want to do that. Somebody with OCD, that thought is amplified on steroids, and it gets their emotion, because it hits a value, will flood it. So they will feel without any sort of reasoning that it just is absolutely true. And what if it is true? And so that's why with OCD, it can go into whatever they might value. What if I wanted to harm children? What if I want to harm myself? And they're fearing, and their compulsions are avoidance of those situations. But that's the safest person to be around the person. But what if I get that diagnosis wrong, and somebody's coming to me and they're saying, they're going to a doctor, like, I'm having thoughts of harming myself and I'm scared. And they don't understand how to clarify and understand the symptoms and understand how to distinguish diagnoses. And they go and treat that individual as a threat. Well, what they're doing is feeding the disorder to the point of causing them to have their face their worst case scenario, and would make them tenfold worse. So these are the issues of, like, the mind is, we have these diagnoses never to label a person, but to say that anything you've experienced, anything that a person's going through, you're the first one susceptible to those unique symptoms. And there are specific diagnoses that can account for that. Now, here's where the issue is in the mental health arena, is that you've got some providers who are only approaching it from the biology standpoint to treat the emotion and the symptoms. But remember, the brain has laws for efficiency's sake, that the more I act upon something, it creates a muscle memory, a pathway. Like a medicine doesn't change that. The medicine can't make me think different or behave different. And that emotion's the consequence of me acting upon that thought for so long. And then my brain will send that feeling to make me do the same in the new environments again and again for efficiency's sake, just like a muscle memory that might make me really effective that I've refined in a work environment. So when we over-identify with it, though, it starts to mess with and open up other symptoms. Like whenever we don't like something, whenever something's getting in the way of our values, it's designed to, another part of the brain will send memory of all the other times we face that thing, and it'll send another hormone to make you want to hate and eliminate the problem. But what thought did I say is the problem? Is it me? Is it that environment? And so then that's going to send that anxiety response to stay away from it, or hate, eliminate. Suicidal thoughts will always be associated with an over-identifying of something on the way. And so that's going back to that overgeneralizing has that dangerous consequence, because if I'm saying my struggles are a huge part of who I am, and I'm going into an environment that they get in the way of what I'm really valuing, but my messages in my mind are, but this is who I am, the brain will naturally send the guilt pathway, or however you want to call it, to make you want to hate and eliminate the problem, to review it, to think about what went wrong, so that you'll have the anxiety to fix it.
Yeah.
But what if it's me? What if it's the environment? So that's what creates that cycle of avoidance. The more I avoid it, the more I'm confirming it. And these are the devastations of not getting the right diagnosis.
Yeah.
Is that then if you don't have the balance of the interventions of biology with the psychology of the accurate evidence-based interventions. For example, with Rosefuss, we'd scan people's brains pre-treatment and you'd see the imaging and it looked no different than anybody else with that severe of whether it was OCD, PTSD, depression, you name it. And then you can teach them, they can sit on a couch, they can talk about, they can have every perfect answer. Every knowledge is stored in one area of the brain. It doesn't translate. That'd be no different than the best athlete in the world sitting you down and talking to you about how to do everything. You could answer and you'd have all that knowledge, but you will not have the instinct unless you go out there and practice.
Steph Curry teaching you to shoot a 3-pointer, like, okay, have your weight back,
exactly,
your elbow up, follow through, follow the path up through your nose, past your forehead. That's like, it's not going to mean anything if you're not actually doing it.
Exactly. And so when you think about it, then, okay, so then give me the correct approach to whatever the struggle is.
Yeah.
So if it's basketball, I want to go to the best because they've shown how to achieve the best in the here and now. Why do I need to recreate the wheel and make it up like it's never been done before? That's the over-identifying.
Yeah.
Faking. But that's no different than what the diagnosis is about. We do a lot of neuropsych testing where treatment hasn't worked. And so they're coming, providers are trying to get a clarity of like what's going on, what's the accuracy of treatment, where should we go with it? And when I'm giving feedback, they'll be like, how in the world do you know me? They're like, I don't know you, and I explain what the testing is anybody on earth who answers the questions you did the way you did them. And all these results will always yield these experiences.
Well, I feel like, and one of the reasons why we wanted to have you on here and greatly value your experience and your knowledge and understanding. I had read an article a while back. The average length of time of diagnosis for people in the United States with bipolar disorder is 8 years, right? And so if you think about someone suffering from this instance, bipolar disorder, it would seem that from my point of view that a lot of providers may be hesitant to diagnose someone, right? We don't want to label them. It's almost as though they feed into their stigma.
That's why.
Of, people stigmatize mental health care, but yet then even like the very providers that are in the industry are the ones that are also passing that stigma on by saying, rather than, correctly identifying and diagnosing someone, we're just going to treat it as depression first. And so maybe they treat it as depression. They try to use, several different prescriptions or even degrees of prescription. And then, okay, well, maybe then they change the diagnosis later. They go see someone else and, their life is falling apart.
Yeah.
Meanwhile, it's like they're not portraying the evidence or what word am I looking for here? The characteristics of someone just with depression. It's like they're having manic episodes, right? This person is clearly displaying bipolar disorder, but yet maybe by the very nature of it, they're not communicating that to who they're seeking treatment from.
And you hit the nail on the head that because of the biggest, social culture towards psychology is that sort of embrace yourself. Then a lot of times it's the idea of a diagnosis then can perceive as a label.
Yeah.
So as a result, let's stay away from it because it's thinking in that same framework.
Whereas in reality, I mean, in my view, it should be no different than this person has cancer, this person has, liver failure, this person has a broken leg. It needs to be treated for what it is, not like,
it's not who they are.
We don't want to call it cancer. Like, that makes this person feel like they're a bad person. It's like, it doesn't make you a bad person, it just means it's something that you have. And we treat disorders of the brain differently than we treat disorders of the body.
Too many do. And that's the danger, is because the laws of conditioning, it doesn't make that go away. So as a result, it is true. So which means then if somebody's going through something, like we all have symptoms. I always try to describe, like, think of a symptom like, I'm having a hard time concentrating in a certain environment. I feel anxious in a certain situation. Symptom, and then compare that to like a star in the sky. But a diagnosis would be a constellation, and there's a minimum set. And when they impair functioning and they're impacting that person's life, that diagnosis or diagnosing correctly we made those names up because of these organized things that we've seen in the human experience in key regions of the brain. And then that name helps organize understanding what goes into it and what interventions would work.
Yeah.
So as a result, if you don't get the accuracy of the diagnosis, and we have the tendency that the brain wants to be efficient. So as a result, if I have something like bipolar disorder, bipolar 1 or bipolar 2, then when I'm in that hypomanic state, whatever I do starts to condition my brain. It starts to change my relationship in that environment. It starts to go no different than an athlete who maybe started to adopt a different problematic style. That's going to, like, for example, a common one after an injury for an athlete.
Yeah.
They're focusing on not putting too much weight and where they put their energy so that they don't cause problems to that damaged area so that they can heal. Well, then all of a sudden, once the healing occurs, and all of a sudden their shot averages plummet when they're in certain areas, and like, what's going on? Done neuro scans and neurofeedback, and all of a sudden you can see that when one foot's forward, when they're leading on that, putting more weight, their stress system, their observation of protection is on, just as it once was. And they aren't thinking about it.
Yeah.
And so, now you just need to consciously notice that you're wanting to do that and uncondition what you conditioned to help the healing. You're already healed, so you don't need to do that anymore. Now recondition it back.
Yeah.
Same principle works. So that's why even that short period of time for an athlete who has a lot of years of a good muscle memory, one moment of really conscious effort to protect themselves or to behave a certain way can mess with that conditioning.
Yeah.
Same principle with an untreated diagnosis is all of a sudden that individual goes into an environment. Now it changes their relationship with who they are in that environment and how to deal with it in the future. And it will only grow unless it gets unchecked, unchallenged, and untreated.
Love it. So I have a list of questions here as we kind of try to get a little bit toward the end. I feel like I could keep you here for hours. So I wanted to kind of hit on a few pieces of practical information or recommendations of things that you could give to people that maybe noticing things in either their life or in the lives of people around them that they can do to be able to make steps. So if you begin to see early warning signs of mental health struggles in someone you love, what would be steps that someone could take to be able to recognize that and then make steps to help make it better, whether this is a child, a spouse, significant other, close friend, family member? What would those steps be?
Yeah, definitely. On the anxiety side, let's say first starting with, like, if it's children and you notice a lot of fear, it seems natural for us because we love that child or we don't want children to be perceived to suffer, to help them with maybe some of the avoidance or staying away from the things that causes that anxiety. That can be quite detrimental because the fact is what that does is reinforce that fear response. The biggest and the most ideal is celebrating and modeling and practicing, celebrating, facing a hard situation. And when they felt really uncomfortable, that you're paying more attention to what they did and you're teaching them that that's important. So that they're teaching their mind at a young age, if they're vulnerable to anxiety, to pay less attention to the physiological fear and more of look at it like a proposal. And then ask the question, like, what is it that I'm really scared of? So that we can look that in the face. And then that can help them. Because some children will be susceptible to feeling physiological symptoms of anxiety. They're going to be more susceptible to developing panic disorder in the future because their body is loud in the way that anxiety comes on. So a parent helping them celebrate feeling when they're uncomfortable, they did something. If somebody has more thoughts, like, what if this goes wrong? Teaching them to pay more attention to how they handle the situation, how they respond to it, and less about the results themselves, but what they have control over on how they responded, the practice that went into it, what they gained from it. So the anxiety is they care. And so then not rewarding and focusing so much on the emotion, but teaching them to, it's a proposal, but let's look at what is it that we're really scared of, because maybe that's a justified fear. We want to stay away from that situation. So good job staying away. So teaching that, because that is one of the biggest things that leads to future suffering, that the person has been so used to avoiding the things of discomfort that it compounds and compounds. Now, on the other one, the mood of avoidance, a lot of avoidance, a lot of disengaging, a lot of negative thinking, that also becomes an accelerant of susceptibility of repeated episodes in the future of depressive disorder symptoms, and can make it so that it compounds. And so the more that, and I'm first starting with children as a modeling of looking at what went well, focusing so much on eliminating problems or threats, put so much energy on our environment having power over us, but celebrating and teaching them how to respond back, how grateful they were and celebrated how they handled how that bully was talking to them, and teaching that balance of physical safety versus emotional safety, meaning when somebody's saying something, I want to spend some time with teaching my child how to look at why somebody might say those things.
Yeah.
And then how to then interpret it. What message and what thought should I have? Because if I just automatically say they were emotionally abusing me, my brain then, through avoidance, will start to reinforce and go, got it. People have the power over my emotions and who I am and how I feel about myself. So the more I avoid, the more it compounds and it'll get worse. Those are the teaching. Now, if you notice a loved one, when I was at the Pentagon, we reviewed every completed suicide in 2013.
Which, really quickly, and we didn't hit on this earlier, tell us briefly about, leading up to this, your experience in the military and then ultimately serving in the Pentagon. Just really quickly to kind of preface the story a little bit.
Yeah, so got the health profession scholarship, interviewed. They could pick only a certain amount of people who they'll pay for their schooling. You become an officer, then you go into officer training, and
so is at the conclusion of your doctoral training?
In the middle of it.
Okay.
You compete to apply for it, so that it's an interview process, a stack and compare who they want to invest in so that they're coming in as a trained officer.
Gotcha.
So I did that. And so then my 5th year doctoral school was at Joint Base Andrews.
Okay.
And that's the president's base. Amazing experience, a lot of rotations. So that was a good experience to push, because they cared only about people who they could just trust and drop and release. So it was a lot of trust. Wounded Warrior Plane would come in twice a week. You'd have to evaluate everybody. Did rotations at the NSA building, different places, the Pentagon. I got the opportunity to be a part of the working groups at the Pentagon during that time. And there was working groups with different specialists, what Congress would put together to stop and get ahead of where problems were going. Where's healthcare going? All of it. So I wanted to know it.
Yeah.
I wanted to understand it.
Yeah.
Just one of those avenues was, where is healthcare going? And there is a model called the patient-centered medical home model, which is what we're talking about. That if future, it's going to only be rewarded that if a healthcare professional is working in an interdisciplinary environment that allows for more comprehensive care and is patient-centered. If somebody wants more natural versus traditional Western, it's available. If somebody wants traditional Western, but it's all evidence-based, it's integrated, it's not isolated, like here, go to this specialist, that they don't talk. So that's where things are going, and they were the They were the pilot site for Congress investing in where we're going. So got to be there. And that's why I wanted to go there. I wanted to see it.
Yeah.
So that pushed me of why I'm doing what I'm doing and where I'm going on that end. Pentagon allowed me to be a part of specific working groups. One of those is they brought in 2 of the leading experts in the world in suicidality. And I got to be one of 8 we reviewed every single completed suicide of 2013 across all Department of Defense to look for the common variables.
No.
You'd often think it's mental health, like somebody had a particular diagnosis that was untreated, unmanaged to a degree. But the most common variables are when huge important areas of a person's life are in jeopardy. When all of a sudden you're seeing that person either, let's say the marriage is deteriorating and you're noticing that person changing in the way they behave. They aren't seeming like their normal self. The more you're checking in and getting into their mindset, how are you doing with all this? If there's limited knowledge, like they aren't talking like the same person anymore, then taking steps and effort. Now, each person you're going to know, like, all right, well, what is my relationship with this person? Am I a family member? Am I a friend? Am I an acquaintance? And so thinking accordingly, acquaintance, like trying to offer and help with resources or just even an offering. A lot of times they won't take it, but who else knows them? Who's closer? Getting their eyes. Because the more that somebody isolates, the more that you start to see somebody pulling away from the important things in their life, like work starting to suffer, family. Those were the majority of the who completed suicide, is when there is this domino effect. All of a sudden it starts here and then it starts to impact other important areas of their life. Now their performance is suffering and maybe their job is in jeopardy. Or if it's an adolescent, something just went really wrong. They failed terribly and it looks like the surface to you.
Yeah.
Why you'll often hear people are surprised with adolescents who take their life. Like, man, they had everything. They were a perfect student, amazing athlete. But the reason is what we were talking about earlier, is the overgeneralizing. Their brain got repetitive practice. And that my worth, my overall sense of who I am, is in these results.
Yeah.
And what seems sort of not that big of a deal, maybe they got cut or they did a stupid thing and now they're suspended. For somebody who is not used to anything like that, and they're so used to performing, and you start to see them isolate or become down. Adolescents, you want to kind of make sure that you're getting into their mind of where are their thoughts? How are they looking at the problem? And if you can't answer that, you want to be anxious because they're susceptible to natural over-identifying. That part of the brain, hate and eliminate whatever gets in the way of my values. So these are watching the things in life that are relevant to that person, not what you think is important, but they find of highest importance, starting to be pulled from them. Those are the biggest red flags.
It makes me think of, I had the pleasure of having a guest on here a few weeks ago, Rob Morris. Grew up here, 2-time All-American at BYU, drafted by the Indianapolis Colts, played, I want to say it was 7 or 8 seasons in the NFL, and won a Super Bowl, played with Peyton Manning. And he was telling the story about how he had lost his starting position, had to play as a backup for the first time in his life, right? He's always been the best player on every team that he's ever been on and had been for the first several years of his career, and then had sustained some sort of injury or something to that effect, and now was coming in as a backup player and having to play special teams earns a starting job back. They go on this run. They go win the Super Bowl. He's rewarded with a 3-year contract extension, with a big payout. And like 3 or 4 games into the next season, he breaks his leg in a game and never stepped on a football field again. And he talked about and shared with us afterward the fallout that had in his life, because his entire life had all been centered around the fact that I'm a football player. Like, this is who I am. I'm the best at this. I'm the best on every team I've ever been on. And coming to grips with, now that's gone. And who am I as a person? What value do I bring? And so it was very interesting. He calls it Resilience 2.0 and goes around teaching this and sharing it, because he thought he had developed resilience and coming back from injuries and had like 16 surgeries, but learning how to value himself as a person outside of just being a football player. And I say this all the time, and I'm interested to get your perspective on this of practical things that parents can do. I sat in a dance recital a number of years ago where I'd listened to the dance teacher call up these girls that were graduating seniors in high school. And, each of the stories sounded somewhat similar, but she'd say, oh, this little girl started dancing for me when she was 2 years old. And I remember her coming into the studio and she's danced for me 5 nights a week, every week since she was 2 years old. And this was her happy place. And she just loved being in the studio. And she was so magical out on the dance floor. And, she's bawling and the girl's bawling, and look down the, audience and the mom's bawling. And I just thought to myself, what an absolute tragedy.
Yeah.
What an absolute tragedy. This girl doesn't even know who she is or what she likes. From the time she's 2 years old, she's dancing 5 nights a week, probably multiple hours a night. And this is the only thing that she was ever even exposed to. She never played soccer, never tried an instrument, never played, volleyball or softball or anything else that a kid may want to go try and do, swimming or whatever. And I just thought, I want to make sure that I teach my kids that their value is not in whatever activity they're doing, right? Like, you are much more than a football player, a basketball player, or a dancer, or a soccer player, or, a guitar player, whatever you choose to go be involved in, that your worth is so much deeper than that. And I also felt in that moment of wanting to have my kids, I guess you may call it, be well-rounded, but have them be involved in enough different things where no one single thing makes them feel like that is their identity, right? Like, having them involved in enough things to where it's like, I am, my belief that I'm a child of God. I have inherent value. I have value to my family. I have value to my community. I have value to, yes, my teams and the sports and the things that I play. I have value in learning and being able to help other people, but my value is not all tied into one single thing. What would be practical advice that you would give to parents? I know in the world that we live in today, there's such a pressure to specialize your kids in something at such a young age, but just, kind of sharing what I just shared, that, at least from my perspective, that, potential hazard of kids being so hyper-focused on one thing.
Absolutely. One is take the principle underneath what it takes to do that thing. So, for example, if it is the dance, that not making it so much about dancing as the sole focus, but emphasizing the success of how dedicated they are practicing something. And that once you put a lot of effort into something and look at the results that can happen, and teaching that this generalizes. And it's important to realize that same thing that led to the success here, you're learning how to work hard and have a goal in mind. And that can be applied to whether you study something at college, whether it's a friendship that you're wanting to work on, whether it's a marriage, whether it's a stressor you're facing with a parenting dilemma in the future. Like, this is a principle, and that these are just vehicles to practice it.
Yeah.
And so that's one big piece. So then allowing that practice of, okay, that's nice theory. Now, when you can put them in an environment and now they don't feel natural because this is new. they've had instinct because they've done something since the age of 2. They don't know how to start again. Harvard did a study where who are the most successful of their graduates doing follow-up of 5, 10, 15 years. The ones who were the most successful in the future were the ones who struggled the most in the past to get the grades and to rise above, who fought hard for A's and B's and had moments of ups and downs versus those who've always had A's because they've never known how to have a B moment, so to speak.
Yeah.
And then in the future, they found in their careers and life that it's not so controllable or as predictable, or the rubric isn't so laid out in life, whether it's relationships. And so you can't just know and learn about how to handle a social situation that went hard. You have to practice it. And you can't just know how and think about how to have a goal and somebody yelling at you and making mistakes and getting up and practicing like in a sport. Yeah.
Okay. And there is so much pressure, especially on kids at such a young age, to perform. And frankly, a lot of it comes from the ego of the coaches or the teachers, right? Whether it's basketball, football, dance, or whatever, any other sport that someone may be involved in, that they want to get a result, right? They want to win this competition. They want to win this game. They want to win first place. And so there's an immense amount of pressure being put on kids at a really young age, not just to specialize, but to get a result, right? And the result isn't just, hey, I want what's best for this kid to be able to learn these things. Like, I want the result of my ego being fed to get the result that I want, which creates a conflict in what you're trying to teach the child.
And so the more you teach the principles across the board and realize I want to create experiences for them to practice it, because just like I couldn't expect them to be good at dance if they didn't practice dance, that I want them to look at anytime they're struggling, that they're going to automatically look at how often do I practice.
Yeah.
If somebody's excelling at something and I'm comparing where I'm at and I can, wow, that's amazing. That's good that I can say that. But I'm going to look at what led to the amazement.
Recognize the pattern
all of those energy so that I can go, maybe I'm not as into that thing and choose not to put time into that. But that same heart and same pattern will always, in whatever I do, will produce similar results versus it's just maybe who I am.
Yeah.
That's huge, is that practice and effort will, with an objective at mind, a striving for something, will put the energy and the level of motivation to strive to get that goal. So those are wonderful things, is to have, I want to try to win, but that's a big goal. Marine motto is improvise, adapt, to overcome. So they have a goal to overcome, like they have an objective, but few situations ever can be predictable.
Yeah.
So that the celebration is like, I'm going to get creative here and I'm going to have to adapt to strive to get the goal met. Healthy goals for the future should be more general and vague, meaning I want to go into something to be meaningful. Maybe it might be this that could provide, or I like, or it could give me enough resources. I want to have a family that blah, blah, blah. It's more general and vague, following principles. And then the healthy anxiety for the here and now is very specific. Let me look at what goes into the response here. Let me go into how I handle this moment. So those are big pieces to teaching and giving opportunity for practicing. One of the biggest struggles is if you teach a person to get very defensive, like put a lot of energy and focus on the other environment that did something, that's teaching the child to let that environment or people have power over me.
Yeah.
To stop them, to need them to stop, still puts too much energy on that. We can make a hope, we can try, but often we can't fix those things. So paying more attention to how they respond, not getting away from their own coordinates of their own values that they want to instill in their children, because then those principles then will follow wherever they go. So that whether it's a boss who's yelling at them, they'll have practice, not taking it personal, that they're looking at an action.
Yeah.
And that's a huge piece of the puzzle, is look at if something's going hard, I want to look at the thing that's being looked at.
Yeah.
And I don't want to over-identify with it. I don't want to let it have power over me, but more or less, how do I handle or respond to these situations?
No, I love it. Last few questions here, so I'll try and leave it at 3, even though I have like 15 more that I wanted to ask you. So the podcasts are called the 1% Podcast, mainly playing on 2 different things. Number 1, I want to interview people that have become the top 1% in whatever area that they've chosen to be in, and help people to learn and to see those patterns in people that have been successful in whatever they've chosen to go into. The second part of it is my belief that largely came from a book called Atomic Habits by James Clear, about the belief that you can aggregate marginal gains for small improvements every day, added up over time, become significant, right? But the primary focus, a lot of the people that listen to our podcast are entrepreneurs, they're business owners, they're high achievers, they're people that are looking at bettering themselves and continue to learn to grow. I know firsthand about some of the impacts that can have on you as you're almost like insatiably trying to become your best and always trying to improve and work on yourself. I'm sure you work with a lot of people like this as well that have, maybe feel like they're never doing enough and they can always do more. What would be a piece of advice that you would give to these young leaders, entrepreneurs, business owners, of how to manage the mental health side of being a high achiever?
Very good. Excuse me. One is a big piece is having a bigger why to why we do anything. Like that can be the faith of an individual. Like you mentioned your belief of being a child of God. Having that bigger why helps us then change our relationship with whatever we're doing, so that we have context to what it is, that it isn't the whole sole focus of who we are, so to speak. It's a vehicle, it's a moment in time, it's a thing that we're endeavoring in. And then it gives a lens and a perspective of who I am, what's my relationship with this thing. So a bigger why.
Yeah.
I saw that as a huge devastation, especially in the military. Finally, I get away from control or this or that. And then when these young troops would start to research and look at there is no bigger why of any sort, they would wonder why all of a sudden they felt with all these pressures, all these demands to perform, but why should I? This is hard. And if my why is not bigger, all of a sudden surprised that they're coming in with suicidal thoughts or severe depression coming on. So having a bigger why can help us give a perspective of why do we handle these things? How do I want to react to this? Next is realizing that don't make it about an outcome. You can have a goal, but enjoy the process. Growth mindset, resiliency mindset is celebrating the effort and the attempt and the practice of getting up again and again. The fixed mindset that we often fall into is, I only achieve when I see the result. So then the practice is just a means to an end. I'm not enjoying practicing. I'm not enjoying refining the skill. I'm not enjoying the learning or development, because my success is only when I see my result. That can burn us out.
Yeah.
Because then we can't be happy. Our stress is too high. And the journey to whatever we run into, finding something you're passionate about is huge. So you love it. And that you can choose to love it too. Far too often, if it doesn't feel natural or easy, we think maybe I need to go find something else. That's where I get back to teach from a young age that just because something is hard, you're normally going to have a negative emotion with it at the beginning. Learn to overcome that and celebrate practicing and getting up again and again. And all of a sudden, when you find a meaning, have positive thoughts. Positive thoughts, which means additive. What am I gaining? What did I learn from this situation? You can do that in any problem, any fall. Teaching that and learning to celebrate that is huge because it increases creativity, adaptiveness. so that no matter what comes, no matter what happens in business or school, oh, I just got a terrible grade, but I want an A. Okay, let me figure out what led to this. Let me go to the teacher and go, can I understand a little more how I can achieve this A? Teaches that I can shoot for something, and it's a process that isn't just who I am. So I want to learn, what is she looking for, he looking for?
Yeah.
So I can adapt to that. That's not faking. That's realizing that they're creating the environment of what is going to be rewarded. There's another environment that you're going to face, a job. It's endless like that. So if you want, I'd say that balance is huge. If you put all your energy in only one area, that is no different than the farmer in the orchard. You're going to see deprived trees that are whittling away, and they're going to be relevant to you because you care about them. And those stress hormones are going to be working to make you hate and eliminate the problem and replace it. So then we think, oh, let me get away from those stressors, so let me go back to the thing that feels good. And the more I avoid that, I'm not practicing in those environments. So there's no such thing as, like, sometimes we use the term balance in a way that makes us think like we can juggle everything at once. No, that you get momentum in one. You're only engaging in one thing at a time.
Yeah.
So that's why that principle of giving your all in whatever's important, but not over-identifying with it. Look for people who you admire what they've achieved. If you're admiring a marriage, the way a parent interacted or is teaching their children, if it's an athlete, if you want to go into a particular type of career, find somebody who you see is arrived at where you would love to learn. They hold the ingredients that got them to where they are. When I asked Rosefus, I learned those from in the realm of psychology. Would I have asked him in those other areas of life? No. But it didn't take away anything of what I gained from him there. There is no this over-identifying with them or the situation. I'm grateful for all those moments. You have to find and model and seek and be humble enough to realize that if you practice, you put energy in any area of life that you want to thrive in, but the brain needs a coordinates, the how-to. And if you just act like, well, I'm going to do my way, then you're going to walk into, that'd be like going into a wilderness, and you see somebody who's been there for a long time, who's very experienced in surviving, and you're like, I'm not going to go talk to them because I'm going to find my way. The amount of errors and mistakes and problems and potential danger that you walk into, the same premise goes for every area of life. Look for models. We are told
I call mentors, right? Like I say that for mentors all the time. Like find people that you look up to, their marriage, you look up to their relationship with their kids, find people that you look up to, how they run their business, what it is.
With them. It's more of look at it as the same ingredient in every avenue. That mindset, what they're doing, how they're doing it. Look at it like a homeostasis. So that when your thoughts, your behaviors veered from it, you're glad you're guilty.
Mm-hmm.
You use guilt to make you hate and eliminate, replace. And you're glad you're doing it. Like, that's the difference.
Yeah.
Guilt should be something you should be grateful for if you really don't want to do something. Mm. And when you change that relationship with it, it's a beautiful thing, because then it's something that you're like, it's not a negative experience.
Yeah.
It's a motivating experience. If an athlete's watching the game tape, they aren't shaming themselves like, oh, why do I do that? They're like looking for what can I gain from it.
Yeah.
And that is that realm, is like, look for it. And when you don't over-identify with it, it's practice. I can modify. Then there's never a moment that you face that if you just keep getting up again, that you won't keep getting better. those famous failure videos of like Michael Jordan,
Yeah.
Walt Disney, you know, all those individuals, repeated failure, you won't make it. But they kept getting up and looking at what they're after and practicing and practicing and practicing. And then obviously the results come.
Yeah.
So look for and model those and find those mentors in your life.
Love it. I think those are great pieces of advice. A big question, and I think a piece that has a big impact on a lot of people's lives today is the difference in technology that's available today versus what anyone else grew up with, right? Like, we did not grow up in a world where the same type of technology was available, nor did our parents parent us in a way. So like, no one knows how to do this, right? Like, no one knows how to handle parenting with technology. No one knows how to handle even use of technology properly, with themselves, their spouse, people around them. If you would just talk to us for a minute about and give us any piece of advice that you may have on balancing the use of technology with, living and existing in the world that we live in today, and the dangers and threats that social media can,
Absolutely,
create, on top of the fact that it can be a great tool, but can also be a very terrible vice.
Absolutely. Did my dissertation on parenting styles influence on electronic media. So it's a growing realm.
I'm going to need to read your dissertation. So
it's a big piece is recognizing that the creators of the search engines and the things that the principles of how it works, all the algorithms, they applied neuroscience to it that follow and mirror the brain. The same principles of conditioning.
Swiping, sounds, notifications.
And that's why they can have predictive value of profiling you with a certain amount of clicks better than most people who know you well, because they're creating an algorithm system that is following those laws of the brain and how it works. They also are going to follow the laws of conditioning, so that what I search and what it prompts is going to meet me where I'm at and try to guide me where I might want to go. Maybe somebody put more money into this particular part of the marketing. That's how the algorithms will work, is that they'll be favored and profiled how to shoot more little pop-ups for certain individuals. Mm-hmm. So knowing that, getting ahead of it. So like, for example, authoritative parenting model have the best outcome for children in the long run for overall mental health, overall use of technology. And what authoritative and how it was defined is, and I'll emphasize what these mean, high control with high warmth.
Sure.
The control means there was order and rules. There was teaching behind it. There was a lot of like expectations, and the warmth was expressed out of love, and there was teaching behind the why and the control. So that if the child was asked, how do you approach your media? Like, well, my mom or dad or that says I can only use it this much, and this is what kind of things I should watch, or this is the kind of things. Do you know why? And they'll be able to answer.
Yeah.
If they don't answer, then it's going into the authoritarian realm. And the authoritarian is high control with low warmth, low explanation, low feelings of love. And they will have certain kind of a little more anxious, a little more fearful, a little more hesitant, less confidence. If it's permissive, high warmth with low control, having a hard time in environments that require order, like school, responsibility, more defiant, argumentative. And laissez-faire is low in warmth and control. That's where people are trying to go all out and just get things from what they aren't getting there. So that authoritative approach is ideal. And that can also be for our own selves. What is my rules? Because it can accelerate conditioning because of mirror neurons, the way it works. So what I expose myself to, my brain will want to expound it. Because it's digital and it's seeing things, it will project better. It'll actually impact my the way I see the world, how I want to approach it, even my instincts. So it's been found that if somebody is exposing themselves to more educational, more developmental, it's enhancing you, it can supersede things that aren't on technology. So it's not just that media is bad, it actually can be an accelerant for helping us expand knowledge, awareness, capacity. But if it's purely like entertainment, that should be done in almost like eating desserts.
Yeah.
Moderation, because that has been found it sucks energy. It's a dopamine hitter more than just even normal media is. So it gives you a dopamine hit, but then it's sucking it from you. So the person's going to be more irritable and agitated and more bored everywhere they go. So listening in school, focusing at work, it's going to feel like it's tenfold more difficult to do that because the brain's used to being acted upon. And so realizing it's like dessert doesn't mean it's all bad. It's just like, that's the moderation of how much with that.
No, I think that's a great analogy. And I say to young people all the time that people don't get more disciplined as they get older. Generally, they get less disciplined, right? When you're in some sort of authoritative situation, right? Like you wake up in the morning when your parents tell you to wake up, you go to school, you go to class, like whatever you have in life is very much structured for you. And then as a society, we generally tell people that by the time you're 18 years old or 21 with regards to alcohol consumption, you can pretty much do whatever you want, whenever you want. And most people don't know how to self-regulate or self-control what they're going to take in. I love the analogy that you used with dessert for social media, because as people become less and less disciplined in their lives, that's really where you see the divergence between people that become highly successful and the ones that don't. When given the option of being able to do whatever you want, what do you choose to pursue? What do you choose to spend your time on? How do you choose to regulate yourself in your decisions versus, you are free to kind of choose all these things, but you're not free to choose the consequences of them. And
Absolutely.
the consequences, end up playing out in a lot of different ways. And I think as you taught really clearly, like there's a lot of really smart people that are using psychology and neuroscience to program these tools so that they basically work either for you or against you, depending on, what it is you're trying to get out of them, and that having the ability to be able to be disciplined. And I think with parents, I think that authoritative approach that you described is perfect with high control, but also high warmth and high love to be able to help teach and educate your kids on why we do certain things and why it's important. So I think that was great, extremely insightful. Last question I wanted to ask you. You had recommended a book to me a while back called Man's Search for Meaning that was life-changing and I feel like had a massive impact on my life. So I would highly recommend that to people, and I recommend it to people all the time. So Man's Search for Meaning by Dr. Viktor Frankl is a life-changing book that you'd recommended to me. Do you have any other, if you were to give a recommendation of maybe 2 or 3 books to anyone listening that you have found to be helpful for you or those that you're instructing or teaching or speaking to?
In all honesty, I'd have to say that The Man's Search for Meaning is probably the most widespread for all audiences. Whereas every other book would be a little more targeted to a specific avenue of life. And why that one is so powerful is because it already has this effect of, it doesn't matter what I'm going through. The message that's coming from that book supersedes anything that any of us will ever go through in life, where
the only thing that can never be taken from a person is how they choose to think and feel.
Exactly. Meaning Viktor Frankl, psychological provider, but then was a Jew in the Nazi concentration camps. And he was studying not only himself, but every other individual in there on who becomes less susceptible to suffering and wanting to look at the variables of that. And that's why the name of the book is Man's Search for Meaning, that when there is meaning in the individual's response to stressors, and that's where they focused. Longitudinal looking at those individuals. their adaptiveness, their overall quality of mental health, happiness of life was correlated. When the individual focused on getting rid of the suffering, stopping the thing, they suffered so much more, putting so much energy on their environment. And those who literally, it was about, how do I handle this? Like, I'm starving, but a child next to me is starving, and finding that deeper meaning, and I give them food, and I find meaning to that, in that pain, in that discomfort. That then is investing in an inoculation of the many things that life does throw at us, which is outside of our control, whether it's cancer that surprises a family member or an individual, a death that came out of nowhere with a motor vehicle accident, a shutdown of a company that you might be in, you name it. Things can hit us that we never anticipated. And so that book kind of hits that deeper realm of how to focus on our response to whatever comes. And that should be the biggest focus.
And I didn't believe that for the majority of my life, right? Like, I didn't
Sure.
believe that we get to choose how we think and feel regardless of the circumstances. I was very much a belief that your circumstances often dictate the response that you have to things. And certainly I think that's
Sure.
natural, right? But to get to the point, and I'm certainly not there, but I'm working on it.
And think of it like no different than the athlete practice. It's
Yeah.
more like, I'm glad I'm going about this, and that struggle makes sense. Just like I shouldn't expect, if I learn a new instrument that I've never played before, that I should just be able to have that instinct, have that muscle memory. And I shouldn't look at learning it like, when do I get to no longer have to practice? Like, I want to enjoy the journey of it. I want to make sense that it's hard. Let myself realize that's normal. So when I'm thinking about that mindset and it feels so impossible, realize that me trying, that's the first step. And with time, it will get better. But out of all the other options, this is the one that, with the results and with it making sense, this is where I'm going to put my energy, and I'm going to trust the process. Then we look back and we're like, wow, it's a lot easier. And meaning it's a lot easier to do that than it was in the past.
Yeah.
Versus, when will I be able to do this? It's not working for me. That's the mindset when we get into it, the fixed mindset. I'm looking for my result. This isn't working. Next. And so patience and persistence in investing in something that has evidence in its results, whether it's a mentor that you're like, yeah, I'm seeing a pattern that's across the board. People are successful. That's their mindset. That's their approach. Trust it.
Yeah.
Same across the board with even trying to change our own mindset with how we handle a problem.
Love it.
Be patient.
Dr. Gibson, it's been an absolute pleasure to have you on with us today. Appreciate you sharing everything with us. If someone would like to get in touch with you, someone would like to connect or reach out to you, or even begin seeking treatment or something else, what would be the best way for people to contact you?
Yeah, so looking up GPS Psychology and Anxiety Clinic. So we have 2 different sites, Caldwell and Meridian, and we're starting one in Emmett. But yeah, if you call the office by typing that in, you'll be able to find us in a Google search.
Awesome. We'll make sure that we link you guys and share your website and contact information in the podcast, as well as the clips that we share as well. Thank you again for being here.
Of course. All right. Thank you.